My name is Rich Maxwell, and I was diagnosed with cutaneous T-cell lymphoma back in February. I had the rashes on the arms and legs for what appeared to be eczema. The patches got crusty. Then they started to raise up. Plaques, as I've learned that's what that's called. And even a couple places there were tumors where they had risen up a lot.
So cutaneous T-cell lymphoma, or mycosis fungoides is the other name for a particular type of it. It's a rare cancer of the skin. It's a type of lymphoma, and these patients are usually not considered curable, meaning that it becomes a chronic lifelong condition. And sometimes in the earlier stages of the cancer, they just have a few spots on the skin that can be more easily treated with just focused treatment to one or two areas. But the patients that we see that are good candidates for total skin treatment are people with diffuse involvement of their entire skin surface, and that can become really painful and uncomfortable for the patient, and a lot of times they get to a point where some of the other treatments aren't working quite as well, and that's when they're referred to us. The therapy is something called total skin electron beam therapy. This type of radiation, electron radiation, is a very shallow radiation treatment, so it penetrates just under the skin, about 1 to 2 millimeters. And what radiation does is it damages cancer cells. So it damages the DNA of those cells, and then over time they die off. It usually takes a few weeks for the cancer to die off. And to deliver a very shallow radiation like this lets us be able to safely treat the entire skin surface without treating the inside of the body.
That was remarkable. In terms of the impact that it had, I mean, it really made a difference in what I could see happening on my skin and things, the plaques and the patches going away.
So I think the main thing when working at an NCI designated cancer center in an academic institution like this is that we can focus on patients who may be a little more rare. So we have to really think about what's happening inside the room as a whole. With total skin, it's not really a nice conformed beam anymore. It's really just like a big spray tanning booth of electrons that gets thrown all about the room. And so we have to be able to calculate how much dose is going to the patient, how deep that dose is going to the patient, and how to make this as uniform as possible with the patient.
So if there's anything uncomfortable about receiving the therapy, there would be two things. One is standing in the same position for 4 minutes, which, can be a little uncomfortable. And I've never had contact lenses in my life, and they put these little eye cups in to protect your eyes. And it's like putting in contact lenses. The radiation therapy was just, I mean, it was truly remarkable. I mean, my wife and I, would stand and look at my body, because mostly on my arms and legs. And I mean, it was like night and day, and it was only 2 weeks of treatment. I want to deal with this. I'm 74 years old, and I've got plans, and I want to do things with my wife and my daughter, and I truly believe that this is the team because they're going after this and not being cautious about it.